I find all kinds of autoimmunity of the brain and body that's just 100% spike protein related, which is appalling for where we're going to be headed in the next 10 years, man. I'm terrified. That's going to be so ugly. But also microcurrent. I was like, you need a microcurrent machine and you need a PMF converter, and you're going to put them in bed every night, and you're going to add the first 3 days, you're going to do just the concussion protocol. Most medical doctors don't even know what PANS and PANDAS is, and even if they've heard of it, they don't believe it exists. And so none of the testing is in the regular medical system.
And I think that's the big difference between functional medicine and just your quote-unquote regular doctor that's happy just treating symptoms. Right. There's a brilliant naturopath in Canada that uses 40 and 0.1 on the whole body, because he's like, why am I picking just one tissue? And sometimes you have to put in the good before you take out the bad, because it doesn't matter what you're eating or what you're doing if you're not sleeping.
Thank you for subscribing to the Frequency-Specific Microcurrent podcast. FSM is a breakthrough tool for medical practitioners who feel stuck with limited treatment options, especially for complex issues unresponsive to conventional care. FSM training is the best continuing education course for medical practitioners. Get our free introductory webinar at Frequency Specific, or find FSM trained practitioners at frequencyspecific.com/find. Here's Dr. Carolyn Kim Pennis.
Hello, everybody. I am by myself today for just a little while. Let me know if you can't hear me. I normally have time to test everything out, but busy day in the practice. I had to race home, get to spend some time with you all. So before our guest arrives, and yes, I have a guest, you're not just stuck with me, a couple announcements to make on behalf of FSM Sports and Frequency Specific Microcurrent. Obviously, we have the amazing advanced meetings in Arizona in March. And between now and the next 27, 28 days until the end of the month, it's a great time to register because you have the early bird savings. So everything is cheaper. The airlines are on sale. You can get your hotel locked in and you can save on the courses. So before I forget to mention at the end, because I know this episode is going to go super fast, just wanted to make mention of those things. And this is going to be one of the last times to do the sports courses because we are changing those modules into the FSM rehab courses. After some years of teaching it, I decided that doing it in 2 days just wasn't enough, and I wasn't feeling good as a teacher and an instructor trying to cram everything in. So the FSM rehab courses are going to be divided up in 2 modules. We're going to do an upper extremity and a lower extremity, and then we can spend 2 days doing deep dives into all the pathology and all the things that you can think of for upper and lower, and take time and doing a lot of practicum, because this is going to be almost like a hybrid course where you can do a lot of this stuff online, get continuing education credits for that part, and then come do 2 days with me, do a lot of manual therapy, stretches, intrinsic mobilizations, balance practicums, all the things that you would need to finish the rest of the story once you learn the frequencies. So I'm super excited about that. That's going to take place next year. The dates are almost done. They're almost locked into the calendar. We're going to be up in Canada a ton. We're going to be in Europe. So it's going to be great. I'm going to slowly introduce our guest because she is also running a little bit late. She's been on the podcast before. If you have any ideas, throw it in the chat or put it in the Q&A. But she's one of my favorite humans on the planet. She talks almost as fast as me. And I think that's why we were fast friends as soon as we met at the advanced. And that's another thing, if I can just go into the advanced really quickly. For those of you who come in person or who are on the fence, whether you just want to come online versus in person, coming in person, you have those abilities to make friendships that you're going to have for the rest of your life. You have those amazing conversations at lunch and in the hallways, and there's just something really special about seeing everybody in person. But for those of you who can't, coming online is a really great option as well, and sometimes we can't travel. So I don't see anything in the chat or Q&A, which is a shame because I was pretty sure somebody was going to guess who is going to be my guest. I'll give you guys maybe a couple hints while I look for her in the waiting room just in case. No, not yet. She is a doctor. She has been on before. We were just talking on the phone about an hour ago about what we wanted to talk about. And even within that conversation, briefly, we had talked about 10 to 15 different topics that I wanted to pick her brain about. Yes, Denise, you got the last name right and wrong, but it is Dr. Jen Sosnowski. It is a hard last name to say, but if I had chocolate, I would throw it at you. Before she comes on, maybe now that's a great time to start thinking about some of the questions you would like to ask her. It's such an honor to have her on, to pick her brain about so many different kind of complex conditions. And the goal for today, for me having her on, was to pick just a few of them so we can take maybe a little bit more of a deeper dive, because that was a feedback every time we have her on. She talks so fast, I talk so fast, it goes so fast, and maybe things aren't answered as accurately or as thoroughly as possible. So now's the opportunity between now and the time she comes on to start thinking about some of the things that you would like to ask. And I want to make sure that we get everything answered and we don't leave anybody hanging. So we're going to be taking a couple jumps into neuro stuff. We're going to talk about a little bit of autoimmune stuff, some trickier things. So the stuff that I want to take advantage of, her being a functional medicine doctor, that can give most of us who are not functional medicine doctors, at least who aren't here live, and some things we can do to maybe support our practices and referring to someone like her. That was the goal for today. And everything else, I do have a list, especially when Carol's here. I have my list and we never get to go through even half of it. But if there have been some questions, I have my list here of questions that we've bypassed, and I don't ever want to make anybody feel like their question wasn't valued. Sometimes just the hour goes by way too fast, and Carol has so many nuggets that she wants to talk about throughout her day. But one of the things I wanted to touch on as an overarching goal is when things don't go according to plan. Carol has so many amazing success stories that are so inspirational, but I want to talk about a little bit of when things don't go according to plan, because those failures do teach us quite a bit, but they are hard as practitioners to troubleshoot and to go through. Dr. Jen is going to be, I think, an important conversation to have, is when things don't go according to plan, how far do we keep progressing? I had seen this meme on Instagram where it was all these visuals of just keep on going and people give up too soon and the light is right there and people stop. And I'm all for that. But there is a point in treatment, especially for the practitioners that are listening. I think this resonates, no pun intended, with you, is how far do we keep going with something and charging somebody and taking time out of our schedule and making them travel when there isn't a lot of progress? And sometimes we don't see progress as quickly as how everybody wants, and when to pull the plug or when to pivot and when to adapt. So if you are listening live and you want to start thinking about cases that are like that, I think that's going to be an important conversation. And there she is. I want to pin you right now. I think you just need to unmute yourself, or maybe I can unmute you.
Got it.
There. It says me too. It's like me.
I
And
know. That was weird that it says you. I can rename here eventually, but I can look like him.
I love the yellow on you. You're very sunny and bright as always. And I was just giving this kind of long introduction as we were both running late and jumping on, about when, and this is maybe a good one for us to start with, is when things are slow to progress, or if somebody's slow to get better, is when do you pivot? Or when do you have that proverbial, just keep on going, the end is near? And I think about the half marathons that I run, and that last mile is the longest mile like you've ever run, and you just want to stop. And I'm thinking of so many cases in my head where, and I'll just start with frozen shoulder, for instance, because it's one of they're like, frozen shoulder is like my frenemy. I love
I've just been treating one of those.
Okay, so perfect. So sometimes can be super slow and it's just not moving as fast as anybody likes. So maybe this is an easy one to start with, is when do you start bringing in other things, or how many treatments should we be looking at and saying, okay, there's no reduction in pain or there's no improvement in range of motion. What do we do? And how do you keep a patient motivated to keep coming and paying?
The answer to the first one is I usually do 5. I treat as a package, typically a package of 5 or package of 10, and that includes a half-hour evaluation for me. So after their package, I generally will know, hey, you're moving in the right direction or you're not. And then I say, here, it's yours. You can rent one for a while. And then I know you'll buy one, but here, rent one for a while.
Yeah.
And then I usually tell them if they decide to buy it, whatever the cost of the rental is goes into the cost of the purchase. So they really haven't lost anything by that. But typically, as far as I would go with that, I always start treating with pain. So 396, 4396. I want to prove to them that I know what I'm doing, that the
Yes.
machine actually works.
Yes.
And if you get that from the very beginning and it shuts off a big chunk of the pain, then you got
Right.
a lot more time to keep playing with everything else.
And I think that's such a great, and I try to kind of circumvent back to that message a lot, whether you're treating frozen shoulder or something really easy like a sprained ankle or something more complex, disc problems or cord adhesions, something fibromyalgic like syndromes, is we want to get that patient out of pain as quickly as possible. And even if it's a drop in a degree, and so I'm always a stickler with charting the pain before and charting the pain after. And it seems like such a basic concept, but so many of us get really busy and maybe we're jumping into exam room patient to patient, but to talk about the pain when they walk in, and maybe they're stuck on that range of motion. It's still the same. I'm like, but how does it feel? Oh, yeah, you're right. It doesn't hurt anymore. It's just stuck. Okay, that's
Right.
something. And like you said, they need something. You need to prove that this machine that they can't hear or smell or feel is actually doing something.
Right. And that's even more important when I treat internal stuff. When I'm treating brain fog or I'm treating gut function, you don't feel that getting treated. You feel
Right.
the detox reaction. You
Right.
still have the fatigue and the extra thirstiness afterwards. And so they're like, oh, yeah, something's happening. But that's
Yeah.
actually good when they have all that, because
Right.
then they can say, okay, I may not feel the treatment itself, but I felt the results of my cells being happier now, my cells detoxing along the way.
So let's talk about brain fog because this is one that I feel is like our most neglected conversation because and so many people have it, whether it's from post-COVID, perimenopause, menopause, teenager brain, moving into
Pregnancy brain.
pregnancy brain or like Parkinsonian brain. There's just so many things out there that have brain fog as a symptom that I also think people aren't really clear about on patient forms. Either they don't want to admit that they have it or don't even really realize that they have it until it's gone. I'll let you talk a little bit before I ask questions.
Yeah, I spend a ton of time with autoimmune clients and mold and Lyme, and a lot of people with cognitive brain stuff. More so now since COVID. I'm sure everybody else has been seeing that more too. I find all kinds of autoimmunity of the brain and body that's just 100% spike protein related, which is appalling for where we're going to be headed in the next 10 years, man. I'm terrified. It's going to be so ugly. The amount of people that are like barely functional out there. But in terms of where I'm going with them, I have a lady right now with some cognitive impairment. Her husband, I had seen him 5 years ago. Then they moved out of town and they came back through. Husband particularly moved back here to come see me because he didn't say anything. He just said, we want to do some lab work again. I'm like, all right, fine. And then in the going over that, his wife was like all over the place. Was rattling on the same things over and over again. I'm
Wow.
like, she's not doing very well, is she? When I could get him alone. And he's, no, that's why I'm here.
Wow. Yeah.
He didn't want to tell me. He wanted me to figure it out on his own, on my own, which is interesting. The first thing I've done is, okay, let's do COVID testing. Let's see if you guys have long COVID if there's huge levels of spike protein antibody in there, because you can't check spike protein directly. And then we ended up doing some testing for autoimmunity of the brain. We did a Cyrex panel, the Alzheimer's Links panel, because that's what she was acting like. And then we did a neural zoomer plus from Vibrant. And they came back and there's all kinds of stuff on there, interestingly. And husband did it too, just because I have to prove that I'm feeling fine here, but let's at least do mine too. His is just as bad as hers.
Wow.
And he was horrified.
Wow.
But he got vaccinated. She didn't. There's your answer. She'd had a head injury 6 years ago.
Okay.
But so it was interesting doing some of the testing because there's viruses in there, EBV, HSV, and there is pandas. Both of them have pandas, and both of them had HSV and EBV, which is interesting because then you start worrying, then you start looking at, okay, are you guys really transferring this back and forth to each other? Is saliva enough to get that back and forth? That you both got the exact same things in the immune system.
Yeah. Interesting.
That was wild. But treatment plan for them was MERT therapy, our brain treatment that we do, because that's going to be the fastest way to get the brain working normal. But also microcurrent. I was like, you need a microcurrent machine and you need a PMF converter, and you're going to put them in bed every night. And you're going to add the first 3 days, you're going to do just the concussion protocol, and then you're going to add the brain fog one, and then you're going to add the improved memory one, and then you're going to add inflammation in the CNS. And then once you got your whole panel, I'll put it in the right order for you. And we're going to get you guys doing that every single night.
Right. And okay, you are answering my follow-up question. Like we have a great brain fog protocol on
the brain fog protocol is amazing.
Yes. But and again, it's like anything else with FSM so treating brain fog is one thing, but then it's tracing it back to why is the brain fog there in the first place? Because that's only going to get you so far. So talking about COVID, if you suspected COVID was the cause of the brain fog, then my assumption would be run the COVID protocols that we have, the flu, reservoir organ, brain, whatever people have called it, because we don't call it COVID. And then again, figuring out like brain fog is one thing, but you said the one patient had head injuries, right? So if someone has had a history of concussion, motor vehicle, slips, falls, whiplash, whatever, would treating like the physical presentation then be something you would look at, like treating the muscles, the ligament, the discs, the dura, the brain itself?
In her case, I really wouldn't, because she really didn't have a lot of symptoms from it. But treating the CNS for TBI, mild, moderate, and sequelae TBI, that kind of stuff in there, I think would be helpful for her too. But ultimately, I looked at her because we also did a neuroquant on her because we wanted to prove or disprove Alzheimer's. And her neuroquant looked fine. So it didn't show Alzheimer's. So
can you explain that test a little bit for
neuroquant is an MRI of the brain. That the neuroquant is an added technology that gets added to the MRI. So it has to be a certain MRI that can do it. It's just not any MRI, but it essentially measures all the different areas of the brain as compared to normal to tell you whether your brain is normal in size. So if they're thinking Alzheimer's dementia, they're looking at the hippocampi and the base of the temporal lobes to see if they're the normal size. Because if they're particularly shrunk as compared to the rest of the brain, then you're walking down the Alzheimer's path.
Right. Wow. Yeah. So somebody else jumped in with a question about Cyrex testing for spike protein.
Cyrex doesn't do spike protein. Cyrex does a bunch of antibody testing.
Okay.
That's one of Vadas Karazian's and then Aristovis Johnny's stuff.
He's amazing. So I first came across his work. How long have I been in California? 10 years. Probably about 10 years ago, I first moved here because I believe he's from San Diego, or he used to be from San Diego. And he was testing the difference between allergens in cooked food versus raw food. And it was something just really simple. It's like people react to different forms in different ways, and taking these deeper dives into different triggers. It was just, his papers were fascinating.
Yes. And also overwhelming for clients. I don't do all that testing because they would throw up their hands in disgust most of the times. But what I do tell everybody from our standard food sensitivity is like, hey, once you mix your food with something else, you may not be allergic to it at all. You might be really allergic to eggs, but when you put them in bread, you don't even know you're getting them. And and so I can explain why. But I said, we could go into nitty gritties and you could do raw and cooked with this, but long and short is, and I think this was from him at one point in time, you could have all the ingredients of pizza and be fine with them by themselves, and you put them all together, you can be allergic to pizza. And so you could drive yourself crazy with some of this, but it's wild to even think about that.
Yes, but it also gives me a little bit of hope when I start thinking about those angles, because one of the first things, again, I'll go back to brain fog, and just even for myself, I didn't realize I was reacting to gluten until I went off of gluten. And my brain was like, essentially, that if my brain could talk, that's what it was. And I had all this energy and I wanted to think about things that I could pay attention, and I wasn't a spaz and I was emotionally calm. And then a few weeks later, then I realized my gut also had felt better, but the brain fog was the very first thing. Even after about 10 days, I noticed, wow, this is something. Without even my gut feeling. The brain fog, I think, is definitely, I don't know if you have questions that you ask about to figure out if someone has brain fog if they're not admitting they have brain fog. Maybe it's memory stuff, or maybe
Yeah,
it's
it's just the
mood,
simple
like,
memory questions. Are you having word finding difficulties? Are you putting the wrong word in sentences? Are
yeah.
you not remembering things as well as you did when you were younger? And putting it in a phrase that most of us don't remember things as well as when we were younger.
Sure.
So the question
Yeah.
is, where's the dividing line? So that it just gives you the stimulus to ask more questions.
And I think brain fog is definitely one of those things that people make excuses for. Of course, I can't think of things at the end of the day because I'm tired, or of course, I'm irritable with my kids because they're my kids, or like you said, putting the wrong words. People have an excuse, but I think just bringing it to their awareness, I think, can sometimes be really helpful.
Yeah.
And so, again, to go back to our frozen shoulder patient, sometimes we think the progress is non existent, but if you ask the right questions, maybe you're finding, oh, actually, yeah, my shoulder feels the same, but my neck feels better. To me, that's still progress. We're still moving and even making somebody worse. I think I would rather that happen because at least you know you've created a change somewhere. Not that you want to increase pain anywhere, but
You had said at the beginning too that you're really good at documenting the level of pain. And I think that's really important because I think we've all had clients that come back at us and say, this didn't do anything for me. And then
yes.
you can go back and say, hey, even the very first treatment, you started at an 8 and now you were a 5 by the time you were done. That's pretty amazing.
Yes. And I had somebody very recently who came in with a host of issues, and we had to go very slow and very gentle and progress treatments very like incrementally. And she was frustrated, but you just know as a clinician, if I go too fast, this is going to go in the wrong direction. And sure enough, I saw her on a Wednesday, and Thursday night. She emailed me, I'm 1,000 times worse. I almost feel like going to the hospital. My pain and you'd hurt me and blah, 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 blah. And so I called her and I said, okay, with my chart in my hand, when you came in, you said your pain was a 6. When you left, it was a 2. And I learned this one from Carol. What did you do from the time you left to when the pain started? Oh, then I went to yoga. Okay. And then I went to my PT appointment. I'm like, okay. Oh, yeah, I forgot I went to the chiropractor as well. I'm like, all that in one day? Yes, but I felt so great. I cleaned my house and I took all the stuff out of my cupboards and I wiped everything. I'm like, okay. And as she's talking, you can hear her starting to mentally unpack that it wasn't my treatment per se. It was accumulation of many treatments and way too much activity because she had the absence of pain. So charting as a clinician can really help save your butt if you need to go back and say, actually, when you left, things were good. They weren't worse. Or vice versa. Then you know exactly what's working and what's not working. And like I said, anything, I think, even if it's worse, it's a change. You're doing something. And I think that's important to explain to a patient. And I'm sure that with these detox reactions too. I can't imagine people enjoy feeling sick to their stomach or having diarrhea, but something's happening.
Right,
Something's
exactly.
going.
You know something's happening when you're doing all that.
Right.
Yeah. I had a woman recently too that was super, super sensitive, couldn't get out of bed for a month and was just barely feeling good enough to come to the office. And she came in, I'm getting microcurrent. Like nothing else mattered. She's getting microcurrent. And I'm like, I don't know where you read about it, but that's fine with me. We
Yeah.
can be there. But she was like, she was orthostatic, high blood pressure changes. She was like, adrenals were down at nothing. And I was like, wow, this is going to be really interesting. If anybody's going to fail, she's going to be the one that fails because she's EMF sensitive and she runs a whole business online.
Wow.
Now off of her phone because she can't even get in front of her regular computer.
Wow.
So I'm like, oh, where do we go with this? I sat her down. Her husband was with her. Husband's a little controlling. Could be a little bit of an issue. Think it's a very big issue actually, but he came in with her and I sat her down and I sat with her as I ran the concussion protocol. I just put it on her. I was like, I want to see how you do. Within 3 minutes, she started yawning and then she yawned and yawned. I got through less than 10 minutes of the concussion protocol. But you know what? She sat there and go, oh my God, I'm feeling better. I'm feeling better. Oh my God. And I'm like, okay, success in 10 minutes of nothing. Hey, you're detoxing.
Right. Yeah. Isn't that amazing? I think we talk about the concussion protocol as something that makes people sleepy, but sometimes it's like that Benadryl effect, right? For whatever it is, percentage of the population, the kids get all squirrely and crazy. So I think with that change, sometimes it is they become more talkative, even their mood changes, right? Somebody who all of a sudden becomes like happy and joyful and saying that it's working. We all have probably heard the news by now, Roger Billica had passed away, and I had so many nuggets from these really complex talks that he would give us, very simplified. And one of my favorites was with sick patients, sometimes you have to put in more good before you can take out the bad. And the other talk that was really profound was that placebo versus the nocebo effect. And he was always very stern with the verbiage that he would allow patients to use in the clinic. So saying things like it's working, things that were joyful, full of hope. I think he even said he wouldn't let people say, I'm beating my cancer or I'm fighting my cancer, because beat and fight were even considered negative. So you had to say, I'm healing my cancer, I'm curing my cancer. So that story with the woman who's after 10 minutes is feeling that excitement and that joy, to me, that's such a huge marker for success and improvement, even if it doesn't last. And so that brings me to my other thing. Do you come across times where they do walk in with pain at a 6, leave at a 2, but then a day later it's back, or they're frustrated that results aren't sticking?
Oh, yeah. Oh, yeah, absolutely. Sometimes you're not hitting the whole answer the first time out. You're not getting quite the right protocol. You're just touching on it unintentionally. And then in that case, I'm typically going back to my exam. Did I get the diagnosis right?
Yeah.
Is there something else in there I'm missing? Or go back to Carol's charts or a lecture and what am I missing in there? And how would she think about it?
Yeah, I think that's one of the gifts that our FSM community has given us is I can go into your brain, what would Jen do? I can go into Roger's brain, what would Roger say? There's so many people that have so many different scopes, and not to say that we're going to be able to do or say exactly what you guys have, but at least to think about it in a bit of a different angle, I think is really exciting. Like I said, even just going back to brain fog, is yes, we have a brain fog protocol, like we have a sleep and a concussion and all these other ones that we've made. But if we're not finding that driver, it's hard to really, and you're not, I think it's also important to say too, that the clinicians, you're not going to knock it out of the park after one treatment. Sometimes you do, but those small levels of improvement, I think, are important for us as clinicians and for patients that are listening as well.
Yeah, it's interesting for this lady that came in with cognitive impairment that her husband brought in. We found out she's got pandas. We were taught that pandas is a disease of kids, and yet
Right.
she's the third person that I did the neural zoomer on from Vibrant, and they've got classical pandas. They've got 2 of the dopamine antibodies positive. They've got strep antibodies positive. I'm like, that's pandas. Like, we are taught that this is gone by the time they're 15, 16 years old. I don't
Right.
think we got it right at all. I think a lot of people are living with chronic strep. One of my guys that has chronic pandas, he used to run himself to death. Literally, he would deal with all his severe anxiety by exercise. He would be running 10 miles a day.
We have lay people listening. Can you explain what pandas is actually?
Yeah, sure. So pandas is an autoimmune disease of the brain that is typically caused by strep. There's another syndrome that looks exactly the same called PANS that's actually caused by something other than strep. So more typically mold, EBV, some other viruses out there that can be causing it. But it's a panoply of different symptoms. Everybody has different levels of symptoms. So kids, we typically see some tics, motor tics, movements of the face or a hand or something, verbal tics sometimes, severe anger issues, severe anxiety, OCD, depression to the point of suicidality, eating disorders. And I actually recently did pandas testing on a alcoholic because I'm like, she's just severe anxiety, and that's why she's drinking, because she's got such severe anxiety. So for the heck of it, I did a pandas test on her because I was seeing a bunch of pandas kids at the moment. I'm like, she sounds like pandas just in her symptoms.
Yeah.
Sure enough, she's got florid pandas at 35 years old, and she's an alcoholic.
And when are you taught typically that it goes away? It's a kid thing.
By early teenager things, it's supposed to be gone away.
Wow.
I think most medical doctors don't even know what PANS and PANDAS is. And even if they've heard of it, they don't believe it exists. And so none of the testing is in the regular medical system, make a regular medical world for it. But it is severely debilitating and causes severe brain fog because the brain is so inflamed. And then all the anxiety and anger issues just cause severe emotional problems for the kids. They think they're bad kids when they get this rage attacks, or they think they're hopeless when they have anxiety. I think most anorexia kids actually have pandas. I've had 4 kids now with anorexia. All of them have pandas.
Wow.
Are we chasing, and we're telling all these kids it's an emotional problem. You're type A and you're just dealing with your type A-ness by restricting your eating. It ain't that.
Right. Yeah.
At least don't let the patients I've seen. So, how many?
Right. And again, that's taking it one step further and not just settling for, okay, maybe you have an eating disorder and then you take it back. It has to do with a emotional reason and then dealing with that. There's a whole other reason behind those other reasons. And I think that's the big difference between functional medicine and just your quote unquote regular doctor that's happy just treating symptoms.
Right. And I don't treat the diagnosis, depression or anxiety or any of that. I don't treat any of that as a diagnosis by itself. All of it's caused by something underneath. And we need to find out. And surprisingly, a heck of a lot of it's inflammation and autoimmune that we never even thought about.
Why aren't ANA panels part of a regular CBC? It seems like we should be screening for things.
I've gotten to the point where people will come in, they fill out 7 pages of paperwork for me. So they have a lot of paperwork. They're getting every symptom, every organ system they're going through and giving me their symptom list. So I have a good idea of what's really going on with them before they come in. But I'll talk to somebody and I'm like, yeah, you're on the autoimmune spectrum. And they're like, what's that? You don't have any diagnosis particularly right now, but everything you're telling me sounds like autoimmune. So we're going to go ahead and yes, we can test every antibody in the book if you want to, or we can test a few, but even if they're not positive, I'm not going to go by it because we're just going to treat you like an autoimmune. And I'm almost positive you're going to get a lot better from that, and then get their thoughts on that.
And I think that is just such a good way of looking at things too, because when it goes the other way and people are attached to a diagnosis, I have an autoimmune disorder, and then they think it's like a life sentence and there is no hope. And from what I know, working with you personally and sending people to you is there's so much you can do with all of these things to maybe you don't turn something off completely, but I know myself, I had a positive ANA and 6 years later, it's not showing up. So it's either at a point where it's like just super quiet and I'm figuring out how to keep things in check. But to your point, where you said you don't treat the diagnosis, you treat the person and what they're presenting with. And I wish more people would. Oh, and ANA it's an antibody test.
Yeah. Anti-nuclear antibody. You're making antibodies to the nucleus of your cells. So it's very common in rheumatoid arthritis and a few other things.
And I guess you could still have autoimmune and have that normal, correct?
Yeah. Yeah, for sure. It's interesting. I have a guy right now that has a diagnosis of ALS. And so I didn't give up on ALS because everywhere else that's hey, let's put you in the ALS clinic and watch you decline. Literally, that's what they do. And I said, this just had the spectrum of autoimmunity deep down, lots of stuff going on. And then he was the one that had the pandas on top of it. But we got a bunch of antibodies positive. He had EBV positive, he had strep positive, he had heavy metals, he had food sensitivities. And so there's your 3 settings for autoimmunity: infection, toxicity, and leaky gut. So I was like, hey, we can undo this like we could undo anything else. But as I told him, it's a race against time. How fast can we undo all of this so that your symptoms stop progressing before you end up in a getting an NG tube because you can't swallow well, or any of the other things that happen?
Yeah, people can take it from like 0 to 60 really fast. So there's so many things that I want to go on with the hand. Let me just go to the chat really quickly.
Denise just said, can you do this primarily with FSM or combined with supplements? I think I told his wife after I got all the testing back, I'm doing stem cells. I've got a guy that will actually do IV and intrathecal stem cells. Not sure. I know it's not really legal, but they're amazing. So this family has money. So I was like, this is the added push that I can say, maybe I can get you out of this. Not just prolong life, but maybe I can actually get you out of this. But I'll be using microcurrent. I told his wife to get a microcurrent FSM machine plus a magnetic converter because I was like, inflammation in the brainstem. That is the definition of this. Every antibody in the book was high because he'd had a fall. He'd been having some foot drop, and then he had a fall in August, and everything like 5 times worse, like instantaneously. What's a TBI? Massive amount of brain inflammation, like even in the best of circumstances. Then you add that to everything that was already going on. So I was like, inflammation is the name of our game. We need to do the inflammation, the 40 and 10. You need to be running that for an hour every day. And then brain fog, anxiety, and everything for the strep in there. And we might actually combine with some supplements to actually add some nutrition to the brain and some stem cells and MERT therapy, because he's doing all of it. We're like, throw the kitchen sink, and we may actually get to see this starting to improve in the right direction.
Wow. Yeah, ALS is one thing that it's horrific. I don't know. I have not treated anybody. I've known people that have had it, but that is all hands on deck. So hang on. Would you run EBV for long term or just a few sessions?
I'd run it for long term, but I'd also get started on some homeopathics for EBV. DesBio has some really good ones for EBV, and I'd go there.
DesBio, so DES and then BIO, or
yes, DesBio.
And then I believe you have to have an account to get their stuff. I don't know, but if people are interested, you just contact Dr. Jen. She'll help you with whatever you need help with.
You and I had just been talking about DesBio. They're awesome homeopathics for mental health stuff. And I had just taken their PTSD one, and I still owe you some. I was just thinking that. I'm like, crap.
You're like, wait a minute, didn't send those.
But I had used their, anybody that doesn't know, I'm going through a divorce 2.5 years now and still fighting over everything. And it's been a freaking nightmare. And now the other half is, the ex is trying to figure out how to make me incompetent and take away custody of the children. That was the newest over Thanksgiving weekend. I'm like, oh, this is great. Love it. But I did this PTSD thing, this PTSD homeopathics after the conference, because they were talking about it. I'm like, wow, that sounds really cool. And the people that were talking that made this stuff, they're smart. I'd like to find smart people that know more than I do about something. And so I took it, and I was absolutely flabbergasted. 1 month of homeopathic drops, 10 drops under your tongue 3 times a day. And I was a totally different person. Absolutely flabbergasting how much better I felt.
And you said something, we were talking about my daughter, actually, some of her injuries, and you're talking about PTSD. And then you're like, you should take it too. I'm like, yeah, you're right. And you're like, who doesn't have, or who hasn't had a little PTSD? And I think that is another underutilized protocol that we have in the mode bank. Yes, it's long, it's 3 hours, but whatever, run it while you're sleeping, or run it. I usually use stickies, and I'll put things on while I'm cooking dinner, while I'm running errands. Yes, I'm the crazy lady at the grocery store with wires coming out of her shirt, but
done there.
Yeah, whatever, we do what we do. But yeah, PTSD just isn't for like catastrophic accidents or for like war veterans. My athletes suffer PTSD every time they have a career modifying injury, let alone a career ending injury. So anytime somebody's life is disrupted, there's some trauma there. And so the PTSD protocol can be very helpful. That is one of the ones that I go to when I'm not getting a lot of results with something. I have good relationships with patients, but people don't tell you everything that's going on. There's a lot of those type A overachievers. We go to work and we put on our face and we treat patients, and then you come home and there's like chaos. That people don't tell you everything is what my point is with patients. So the PTSD protocol, I won't name it PTSD. If I think somebody is going through something and could benefit from it, I'll ask them a little bit about their mental health and things that are going on, but you can name it something like neurocom, or I don't know. You don't have to use the words trauma or PTSD. Just like a lot of times with my athletes, I don't call the concussion protocol concussion because they think I'm diagnosing them with a concussion. And hockey players and football players, that is the C word. You don't want to say that one out loud to them. So
take you out.
You can change it. Oh.
It's interesting because when I talk about PTSD, because I do talk about it a lot with clients, and I think it happens. I think a lot of my chronically ill people have some PTSD on some level. And so I always bring it down back to myself. I was like, man, I had 6 years of daily migraines. I have PTSD from that. I still carry migraine meds in my pocketbook 24/7, 3 different things, just in case, because that's my security blanket, to know that I'm not going to end up back in the ER ever again, like I was so many times during those 6 years. You're still mute.
She was still barking, that's why. I think that's a really great concept to say, is like, I myself has people don't feel judged that way and they're a little bit more open to, oh, you're going through stuff too. Oh, and then there's no shame or I don't know what it is. So we have a couple more questions. I don't want to ignore anybody. So going back here to the Q&A. Could you talk about using 40 on channel A with Lyme and mold? Once they had it, how do you navigate someone who has had this in terms of using frequencies? And I know Lyme and mold is probably like a half day conference for you to talk about, but do you use 40 on channel A with Lyme and mold?
For sure.
I'll let you start with that one.
I mean, particularly in the brain, there's a ton of brain fog that comes with Lyme and mold traditionally. I go back to the 40 and 10 all the time, or the 40 and 1, like 40 in the whole body. It's a good place to start.
Yeah, and I don't know why we're not talking about this. There is a brilliant naturopath in Canada that uses 40 and 0.1 on the whole body because he's like, why am I picking just one tissue? And he's, by the way, fascia is everywhere. So there's also that. Like, okay.
Right.
Yeah, interesting. Glad to hear somebody else is also using just the whole body. Why pick? It's everywhere.
Exactly. Lyme certainly is everywhere.
Yeah.
And mold affects all kinds of things anyway. And let's get at not just the inflammation in the CNS, but let's get at the inflammation in the brain itself and all the other tissues elsewhere where it can hide.
Yes. Okay. Next question. A 50-year-old female friend had a spiral metatarsal fracture maybe 2 months ago, was in an air boot with lots of inflammation. They treated her for inflammation of the periosteum, fascia, connective tissue, and nerve, but every time results in aching. Louise wrote, common to hear from people in the US diagnosed with gluten. Oh, I thought that was an answer. Oh, hang on. Maybe not. That was probably another question. So going back to the spiral fracture, I'm guessing Leaf, instead of just treating for inflammation, I would have been running lots of 124, torn and broken. So inflammation, again, secondary, tertiary, down the road. When I see spiral fracture, I think of first trauma, right? That was the very first thing that happened. There was trauma to the tissue. And then you have the basics, right? That inflammatory cascade of histamine and paralysis. And then you have 124, and then you have 40. So I'd be spending much more time on 124 and then with those tissues, periosteum, fascia, connective tissue, nerve, and also bone. And then one of my other favorites was for bone marrow edema. I can't remember it off the top of my head. It always falls out of my head. It's 14 and is for the edema, and bone marrow, I think, is to, don't quote me, I have to look it up. But there could be something there as well. So I'm not sure if Jen, you want to add anything to spiral metatarsal fracture.
No, I'd go there too. And if the pain was there on a regular basis, I like inflammation of the periosteum as the basic I go to, and maybe run that even longer because I think it is a huge source of chronic inflammation afterwards.
Yes. Yes. Okay. Perfect. Okay. Louise wrote, common to hear from US people diagnosed with gluten intolerance, travel to Europe where gluten is mostly non-GMO. Coming back, saying while in Europe, I ate bread and other gluten, having zero symptoms they experienced in the US. Also involved is covering saran wrap plastic, changing chemical content of food. Point should be that one shall specified if their gluten intolerance is from consuming GMO gluten. And that's probably a lot of our friend talking about different food sources. And thank you, Kathleen. 238 is bone marrow. So yeah, I'm sure certain celiacs are celiacs no matter where in the world that they go, but I'd probably agree. I'm sure you see the wheat and the foods that we have access to in North America it isn't the same as what they're eating in Europe.
Well, not only is it not the same, but we in our country, we make bread in 2 hours in all the factories versus 2 to 3 days. And the whole rising process changes the gluten to make them way less inflammatory. Changes the gluten entirely, maybe. I don't even know exactly what happens, but it's like the sourdough process. When you let it raise and sit and percolate for a while, you change the gluten, so it's not really the same, and the body a lot of times can do that. And that is really more of what's happening in Europe. Yes, they have better grains, and yes, they don't have the high gluten grain that we created in the US, and they don't have all the pesticides on it. But there's also, it's just how they make the bread.
That's such an important topic. I can't remember who it is. It's Paul Saladino, I think I follow on Instagram, and he talked about bread should look like this, and he pulled out just an artisan, and it's in air quotes, artisan bread should actually just be bread, nothing artisan about it. But like you said, it had the crusty crust on it, and it looked like I don't even want to say loaf of bread because we're thinking of squares. And he talked about since when is bread square? And our loaves of bread are all these formed squares, like for toast.
Right.
And that's not bread. So, like you said, there's something even in the process of that chemical reaction that happens with baking.
That's important.
Yeah.
Yeah.
All right. Denise asked, are there codes for breaking down biofilms prior to mold detox and codes to use in conjunction with binders to help drainage detox?
With binders, it's your liver, your kidneys. That's where you want to go. Just inflammation in those organs and toxicity in those organs. So you start them clearing before you do all the binders and all of that. I don't know that there's particular codes. Detox the liver.
Right. Yeah. And you know what? That one, I'll never forget. I had one patient that was very, I don't want to say sensitive to FSM because it sounds like it's in a bad way, but she's very kinesthetically aware. Those patients that instantly feel if the frequency is working or is not. And she had some liver issues and she had taken the FSM machine home 1,000 times. She's like, can you put on the liver detox? I'm like, yeah, that one might be a good one for you. And then on Monday, she says that should have come with a warning label. I'm like, what? She's like, run something Friday, do not leave house Saturday. I'm like, oh, okay. Was it that bad? And but I felt amazing Sunday. I'm like, oh. I always think about her with that liver detox. I've never had anybody else since then have any issues with it, but we have a lot of the liver support, liver detox protocols on the custom care already done.
Right.
Kate would like to know your information. So how can people find you? What's the best way?
You can find me online. Then you can read about what we do, how we do it, and all of that. So it's mvpmedicalcare.com. Used to be MVP as in most valuable player starting with the baseball teams, of which I'm still working for the Royals. But we also use most valuable person for our clients. So mvpmedicalcare.com. And you can find me, our phone numbers in there. And we've got an email if you want to schedule a consult. We do free 15-minute consults with everybody. And just so we know that we're in the right place, that's something we could deal with before we waste anybody's time or money. So you can schedule that free consult even online without even talking to anybody.
That's wonderful. All right. Okay. Leaf mentioned for PTSD, additionally explore heart math. I believe you are also a heart math.
Love it.
Love it. See? Can you explain what heart math is really quickly?
Sure. So HeartMath is a research group that actually has spent a ton of energy at looking at how important the heart is to the rest of our health. Like, it is more central than our brain. It is our brain for our body more than anything else. And the brain takes orders from the heart. But the HeartMath app that they've got, there's an app on your phone you can get called Inner Balance. And what it does is it calms your sympathetic nervous system and teaches you how to bring your heart and your breathing into rhythm with each other, i.e., slowing down the heart or slowing down the breathing to match the speed of the heart. And within 2 or 3 minutes, you're like ready to fall asleep if you're doing it at nighttime. It's just night and day, different whole body feeling.
Yes. Yeah. Yeah. Thanks for that. I forgot about heart math. How did I forget about heart math? Okay. I want to go to another question here just because it might take longer. Client with Bartonella, Babesia, mold, MCAS, and now discovered has ECD histocytosis. That is the background. But while she is seeing multiple doctors out of network, she is in agony going to their offices due to extreme EMF sensitivity. She has no phones, television, computers, radio, stereo in her home. She quote unquote sparks when anyone comes into her apartment with a mobile turned on. She doesn't tolerate FSM with all delivery methods. Any thoughts on the EMF? Wow, there's a lot going on with this patient.
First of all, you need to make sure she's not a smoker or doing anything to make things worse. And hopefully she's not with all of that. But my client that had the really bad sensitivity could only run 10 minutes of mold, also had EMF sensitivity. And actually she was we ran the concussion program at 40 microamps.
Wow. Yeah.
And we made it. And I sat in front of her. And when I got to the 5th yawn, I said, "You're done. You're not doing it anymore because this is exhausting you. Even if you're telling me you feel okay, this is exhausting you. You're done." And so literally we started with 10 minutes at 40 microamps. And she came in 3 days later because it took 2 days to detox from all of that. And she
Yeah.
came in 3 days later and we did 40 microamps of concussion and we made it through the whole thing. And she started, I think she yawned 5 times in the second half, but she's, no, I really want to finish. I'm like, if I see you yawn a couple more times, we're done.
Yeah.
But it was really slow, really gentle. And I think to a lot of times we don't think about going under 100 amps, but
Right.
20 is fine. I don't care,
Right.
just getting something.
Yeah.
Or treating with water.
So this person said her patient has a strict diet, no sugar, no gluten, no alcohol, and that she said she did try 40 and she feels like she's being electrocuted. I wonder, are you using wet towels? Are you using electrodes? Could you go to the pulse magnetic? Could you even try, and even going down to 20 would be interesting.
Or in water. Spread
Or
it
in water, yeah. If she can sit in the tub, throw the leads in the tub. And that is interesting. I normally have it the other way where I want my athletes to go in the tub because I want all the effects of just being in the tub and just being in warm water. And the guy's like, I don't feel it the same. I'm like, but it's working. And she says she's tried PMF, reduced to almost nothing, not in water either. I've tried that.
there's a supplement from, I think it's Picana, that's called Radonex, and it's to actually detox EMF. So that might be.
Can you say that again?
Radonex is what it's
Radonex.
called, Radonex, I believe, from Picana. I'm guessing. I think that's the one. There's a couple bioresonance. There's a couple of names that my rep that sells that product has. So I'm not 100% sure that it's Picana, but I think it is. But the first thing I did was gave this lady a bottle of it. I said, here, you're going to start with 1 drop under your tongue for 4 days, just 1 a day, and see what happens. And then gradually go up. Because again, less is more.
And sometimes you have to put in the good before you take out the bad. And that's exactly what I'm thinking. Oh, so somebody had just wrote, 2 people wrote on the chat and on that question, what about drinking water that has the frequencies in it? So either sit in the water or drink the water. Annie says, thank you for Radonex. But yeah, Annie, what about if she just puts it in her water? She tries the water and she flares. Wow. Okay.
Then you think PTSD.
But how do we give her the PTSD frequencies?
Right.
But
actually, there's a Gupta. There's Annie Hopper has a whole PTSD calming the limbic system program that's online. That's really good. And there's a Gupta, I forget his first name right now, but he's got an online program for resolving PTSD through calming the limbic system. And it's all online. So a little bit of an issue. She
tried Annie Hopper and gave up.
There's a point at which some people are in their own way, some too. How about some hypnotherapy?
Oh, and I do have to say, Jen has an amazing hypnotherapist that she refers people to. And like a good practitioner, as Carol would say, I'm the perfect lab rat. I like to try everything myself first. So I went to him. He is unbelievable. So he is Skipnotherapy. He does online work. I couldn't imagine how great it would be in person with his voice and like on his couch. But I was the biggest skeptic. But like other things, I was also the biggest skeptic of FSM. I was the biggest skeptic of like kinesiology taping. Those are the 2 things that I can't live without. And now maybe Skipnotherapy is another part. He's fantastic. So yeah, Annie, I believe it's skipnotherapy maybe.com, but it's like hypnotherapy with Skip.
Yeah.
Maybe.
Yeah. His name is Skip. If you look up Skipnotherapy, you'll find him.
You'll find him. He is unbelievable. Phenomenal.
Yeah.
He did.
I always make the guys feel better about it because I'm like, listen, man, he was in the dark world in the military.
Yeah.
Before he got into hypnotherapy. So he's not this like new age, huffy, tooty fruity guy.
Yeah, he's very, very down to earth, very, I don't even know, but like you pretty much summed him up right there. But like I said, I was a skeptic. Do you think you can be hypnotized? I'm like, I doubt it. And then he said, okay, let's just do a little bit of a guided meditation because I do meditate. I'm like, okay, perfect. And then he walked me through this, what he called his relaxation thing. And I was sitting exactly how I'm sitting now. And then he did his thing. And then we were talking. So how long do you think that was? I'm like, I don't know, 4 or 5 minutes. That was 19 minutes. I'm like, no, it wasn't. And for 19 minutes, I was in the place that he brought me to doing some pretty cool things. And he records, so you have a recording to listen to. He's amazing, and I can't thank you enough for that.
Yeah, it took me about 1.5 years to go see him after I heard about him because I wasn't ready. You have to be ready
for
to
sure.
get fixed. But
Yeah.
when I saw him, the first visit's a practice session, but usually the second or third visit do the trick. But I got rid of 50% of my chronic neck pain in one visit, dealing with the issues with my dad. 50%. I was like, whoa.
Amazing. And to go back to one of the things that we had started with, we were talking about anxiety, and he's, how long have you been anxious for? I said, my whole life. And he says, that's not true. I'm like, excuse me? And he's like a man, right? He's, that's just not true. And I was like, what do you mean it's not true? He's, nobody's born with anxiety. It came from somewhere. And I was just like, oh yeah. Like you just have that moment of, but you have to be ready. And it's, I guess, any part of the healing journey, right? You have to be ready for change to take place. And my alarms are going off that it's 4 o'clock, but I want to make sure people know where to find you. So once again, mvpmedical.com.
Yes. And
mvpmedicalcare.com. And people can Google you and they'll find you and all the things that you do. So yeah, thank you once again for coming on. And like I said in the beginning, when I was introducing you, I said, here's a hint. She talks just as fast as I do. And that's always what comes back. I guess if there's going to be a negative is, you guys both talk so fast. I'm like, that's the great thing about the recording. You could slow it down or listen to it twice. So this will be out there. But yes, thank you. And you will also be at the Advanced in Arizona in March, talking about sleep, which we didn't even really touch on as much, but everybody should just come to your talk anyways, because you'll unpack all the things about sleep. Right. Because again, if people aren't sleeping, and again, to go back to the beginning, if people aren't getting better, that's the first question I ask is, how's your sleep? Because it doesn't matter what you're eating or what you're doing if you're not sleeping.
And the second thing I've learned, even if they've had a sleep study before that they were told by that was negative, look at it. Get it in your hands. Most of the readers of them suck.
Really?
They're not doing good reads. No, they're missing all kinds of stuff.
Oh, so is there a company that you use to look at these, or do you yourself look at them? Or
I don't have a sleep doc certification. That's coming, I promise you. I'm doing many of them, but no, I have a couple of people that I use that I like their device that they use that give good data. And then it gets read officially by somebody, but then I read between the lines, and we're going to talk a lot more about that and what they really show. But essentially, if you have somebody with chronic illness, you better be doing a sleep study too, because I bet you dollars to dimes, they've got issues there too.
Oh, so don't believe everything. And sometimes that does make sense when they're like, yeah, I sleep fine. You're like, really? So take a second look and get another opinion. Okay. Thank you once again for coming on.
Absolutely.
We love having you, and come to Arizona and check out Dr. Jen's website and all the things that she's doing, and use her as a resource, because I don't know where I'd be without you.
I appreciate that. And thanks for inviting me. And again, very happy to help with anybody that has the questions. If it's musculoskeletal stuff, give it all to Kim. She's way better at that. But if it's everything else in the rest of the body, I'm happy to deal.
So we're between the two of us, we'll fix it all.
Right.
All right, everybody. Thanks for coming.
Guys. The Frequency Specific Microcurrent podcast has been produced by Frequency Specific Seminars for entertainment, educational, and information purposes only. The information and opinion provided in the podcast are not medical advice, do not create any type of doctor-patient relationship, and unless expressly stated, do not reflect the opinions of its affiliates, subsidiaries, or sponsors, or the hosts or any of the podcast guests or affiliated professional organizations. No person should act or refrain from acting on the basis of the content provided in any podcast without first seeking appropriate medical advice and counseling. No information provided in any podcast should be used as a substitute for personalized medical advice and counseling. FSS expressly disclaims any and all liability relating to any actions taken or not taken based on or any contents of this podcast.